Larger amounts of teenage girls have been showing up at doctors' offices around the world with tics since the start of the pandemic, and now experts think TikTok has something to do with it. Girls with tics are rare. The Wall Street Journal reports these teens had an unusually high number of them, which had developed suddenly. Doctors consulted each other and figured out that a large number of the girls had been watching videos of TikTok influencers who said they had Tourette's syndrome. It is a genetic nervous system disorder that can cause tics, repetitive involuntary movements, or sounds.
Joining us now is Dr. Caroline Olvera from Rush University Medical Center. Good morning.
Good morning.
So is this something that is biological or is it just psychological?
You know, with Tourette's syndrome, even that, we don't know the exact cause of it. So we think there's a genetic component. I mean, the chemicals in the brain also get affected. But with these new waves of girls coming in, and it's usually late teenage girls coming into our clinic with tics for the first time, they tend to have a strong history of mood disorders. So anxiety, depression, a lot of them have complex social situations at home. And so that's really the demographic that we're seeing come into clinic. So we do think there's a big, anxiety, depression component to these girls coming in now, whereas typical Tourette's syndrome, you might have that, but to a lesser degree.
So is this something where, is that even possible? You watch a video like that too much and you develop the same symptoms? Is that something that is a known thing to happen?
So with Tourette's syndrome, it's interesting. So there's a specific tic you can have that's called echolalia. And so the stem of that is echo. And so what that means is you can see different behaviors from others, or you can hear different sounds from others and actually repeat that. So that's known to be a tic. So some of these girls might have true Tourette's syndrome, and that's the tic that they've developed. But in terms of, you can't catch Tourette's, like you just can't do that. You can mimic certain tics, but these girls that are watching these videos and that we're seeing come into clinic, there's something about them that makes them more susceptible to, develop these abnormal movements from watching these videos. So we do think there's a component of watching the videos. I don't think it's the entire explanation for why we're seeing these girls come into our clinic.
But would you say the algorithms of these social media companies exacerbates the problem?
I think it might. So even myself, I spent, a couple months watching TikTok videos. I did not have a TikTok. I've since deleted it. I really don't want to look at all these videos anymore, but I found myself even blinking my eyes a little bit more, doing some common tics that we see. So I do think just the volume of exposure and the time spent watching these videos may make it easier to have these movements. But again, I think you have to have a certain child or teen that's more susceptible to developing these movements watching TikTok. So it's not anyone that doesn't have these risk factors for developing these movements can just watch it and develop it, which is, what I've been seeing a lot reported. And I don't think it's that simple for these kids that are developing movements.
And if you are a parent whose daughter is showing these signs, obviously see a doctor or a specialist, but do you just cut out the TikTok or?
I think that's the easiest thing. And I mean, watching not just TikTok, but social media in general has been linked to worsening anxiety, depression, eating disorders, especially those at risk for those disorders. So there's a lot of good reason to take a break from social media, but tics in general and these movements are very suggestible, and also with increased stress can worsen them. So if a parent is making a big deal about it, making a big deal about TikTok, it might actually provoke these movements to worsen. So I do think there's like a balance in terms of, limiting the use of watching these videos, but, not doing it too much or too little, because I think kids, if you tell them not to use their phone, they're just going to be sneaking their phone and trying to watch these things.
Very true. All right. Thank you so much. For more information, you can check out rush.edu. Dr. Olvera, thanks for joining us.
Of course. Yeah. All right. Bye-bye.